My name is Emily, and I'm currently a senior attending Seton Hall University. And today I will be presenting on my topic, Advancing Long and Productive Lives, Violence Across the Life Course. Violence is an alarming issue, affecting people at all stages of life. Violence leads to a lifetime of physical, emotional, and economic problems. Children who are exposed to violence and trauma at an earlier age have adverse childhood experiences, or ACEs, and that trauma can have a tremendous impact on their adulthood and old age. Specific adverse experiences may include emotional and physical abuse or neglect, substance abuse, incarceration, and divorce. Children of color are at greater risk of experiencing one or more childhood adverse events in their childhood than white children, especially when they live in environments inhabited by those who are poor or under-resourced. This risk increases if there is also exposure to violence in their households or the community. Experiencing long-term childhood difficulties can affect the cortisol levels for tolerating stress and is associated with a 21% higher likelihood of reporting suicidal ideations as an adult. Higher exposure to adversities in early childhood also increases the chance of developing health conditions such as pulmonary heart disease or asthma. Both the perpetration and victimization of violence connects to early exposure to different forms of violence. In some cases of child maltreatment, where there are poor relations between family members and violence in the household, the children can be affected by this exposure in later life. Maltreated children can learn and generalize coercive interaction styles from the home environment to other social contexts. The additions of growing normalization of violence from repeated encounters with violence can lead to a higher likelihood of violence within and across adult relationships. In one study, child neglect indirectly predicted intimate partner violence perpetrations for both males and females. Others reported experiencing long-term abuse as a child, impacting family and close relationships as an adult. Therefore, understanding how violence from adverse events impacts other stages of life is crucial. Measures are taken to establish trauma-informed care, training centers, and treatment to lessen the harm of ACEs. For example, an ACEs initiative was established and included with the Medicare California program's response to COVID-19, which helps screen for adverse events of both children and adults. Since its inclusion in the program, it has helped medical providers conduct 155,000 screenings in the state. Other solutions to be considered include 1. New infrastructure to track violence and capture the perpetrators to prevent re-victimization. 2. Funding for necessary mental health services. 3. Enhancement of long-term studies on lifelong growth and the impacts of bullying, youth violence, maltreatment, and intimate partner violence. And 4. Formal and informal access to resources for economically disenfranchised families. Creating and implementing these strategic initiatives can decrease experiences with violence in the early stages of life and aid in identifying and assisting those affected by violence and maltreatment throughout the life course.